My name is Melanie Rutkowski, and I'm an associate professor at the University of Virginia. And when I first heard about COVID, I recall it was during the holidays, the holiday break. And I wasn't really sure what to make of it, how serious it would be. It was very unclear to me at the time. I went to study section in California when there were cases emerging there in February. And then March came around, and that's when things got very serious. And things started getting shut down. And it was all very overwhelming and a little bit frightening because we have a small child. And at the time, it was looking pretty positive for children. And so, we were really thinking about it from that context and not so much, at least at the time, how it would impact our research in the lab. My initial reaction to the campus institution closing was that, it would last for a few months. And that everything would be over come August. I thought that for sure, it would kind of roll through, and I did not at all anticipate a second, third, fourth, fifth wave. But at the same token, during all of this time, we started adapting and learning as the researchers kind of maneuvered into COVID research how this was impacting us. And the effect for us on the lab was fortunately very minimal. At the time, I was very focused on writing grants, and so I took advantage of kind of the solitude of not being in meetings every day to really focus on getting funding for the lab, and that worked out very beautifully. I did have a student that was affected because they would not let her back into the lab. But I did have a technician who was able to continue moving the projects forward. And so I felt very fortunate at the time because it was not a complete shutdown, and I was able to actually stay home and focus on, keeping things operating from a financial standpoint. My students at the time, one very much focused on writing a review and starting her thesis to kind of try to complete it, while the other one was working on his qualifying exam. And so at the time, we did not have a very big research group, and so these were my only responsibilities. And the timing worked out so that they could very much focus on their writing and stay at home. So our lab focuses on how interactions between the gut microbiota affect systemic immune responses. And traditionally, we've always been focused on cancer and how that affects your immune response to tumor cells. And after COVID, we started thinking about the heterogeneity and how everybody was responding a little bit differently. And we've already been thinking about that with cancer. And so for me, and because of the pandemic, we really started moving into more mucosal immunology and how it affects the upper respiratory tract, how the microbiome affects the upper respiratory tract. And so we're kind of moving slowly towards that direction, although we did not fully jump into it as some groups were able to do. There were some surprises and I would say reassurances with how our institution really kind of handled the pandemic. Some of the surprising things were, there was a lot of personnel that kind of had to be cut down. And that included, for example, within our animal facility. Everybody was kind of moving towards a skeleton crew, even though they were essential workers. And so because of that, we had to really kind of cull much of our animal colony just so that they could take care of everything. However, that did not last very long. And so one of the most reassuring things with how our institution and just the state really handled the pandemic was how quickly they got masks into our labs. The fact that we were able to kind of quickly mobilize and get people back into the lab, which for me was the most important things as it was for our students. How the schools, because I have a child, having that option for them to actually stay at home just because we didn't really know how it would affect kids kind of in the long term, and this was before the vaccine came out, it was very reassuring for us. And then we had a few individuals at the university who started really trying to increase awareness of what is known about COVID and the research that was moving the field forward in terms of the vaccine and ways that you could minimize your exposure. And having access to that on a first-hand basis was huge for me personally.